All right, welcome to the Experience Better video podcast series. I'm Josh Beekler, and today I'm joined by Jenny Everly of Grand Island Physical Therapy. And today we're going to talk about a manual therapy technique called Graston, which is part of what we call instrument-assisted soft tissue mobilization. But we use actually these tools here, and Jenny's going to demonstrate them later on patients. So Jenny, tell me why, or what's the theory behind using a device like this?
So the good part is I can cover a large area very quickly with a form of massage. So this is just another form of massage. A lot of my patients like really deep tissue massage, and sometimes my hands wear out and I can't get as hard as they want. So these tools really help me get in there, especially on nooks and crannies or tendonitis where I'm really trying to get in there and dig hard. Also, I use some of these to do like traction or mobilizations to certain joints too, and they work wonderful.
So not only does it extends the life of your fingers, but it's actually maybe even a little more effective than using your hands or it can be as effective or even more effective.
Exactly. Sometimes like on the knees and the feet, I just can't dig. I can't get in there as hard as the patients want. So these tools help a lot.
Awesome, very good. So what kinds of conditions do you treat with this?
So the main thing is just any tight muscles or a large area that I want to get to. I can do these just as I could a massage, but this gets in deeper and quicker.
Very good.
The other things that are very good for our tendonitis, like I was just telling you with the kneecap or the feet, to really get in there and do a cross friction massage to get that area relieved. Some of these tools are good for help getting shoulders moving better. On bigger people that can't do traction on their necks, this one works wonderful.
Oh, I gotcha. Okay.
So
very good. Well, let's show them how it works.
Okay. So let's say Josh would have tennis elbow, okay? So we just put a little lotion on the area so I don't rub the raw and make sure that the tool glides easily. So a lot of times I'm just coming in like this, and it's kind of neat, honestly, if there's some trigger points or tight muscles, I can feel grittiness through the tool itself, and I can feel that go away. And so I just usually work that area until I get it nice and smooth, or if it turns bright red on me, I quit.
Gotcha.
Because I don't want to bruise the patient.
So you can actually tell from when you start to when you finish
exactly
the quality of the tissue and what you're doing has been effective.
And I'm sure if anyone knows what I'm talking about, if you feel your forearm or your leg and you feel that tight band of tissue, that's what I'm trying to work out.
Yep.
And you can see Josh is getting a little red here, but it's not bad. And it's not uncomfortable, I don't think.
Nope.
It's just nice and smooth. And so you can see these edges are beveled. So it's not like I'm hurting them or cutting them, some of them look like knives, but they're nice and smooth. So we're just rubbing that area to get it released.
So will I be sore later, do you think? Or like what's kind of the typical 24 hours after?
So 24 hours, I always warn people, it's like you're sore, you're achy, like you had a hard workout, the muscle's been worked, okay? But after that, you should feel looser, you should feel good.
Right. So maybe a little bit of soreness initially, and then over time,
it should feel better
and better all the time. So.
Exactly.
Very good. Well, be sure and come see Jenny at Grand Island Physical Therapy for all your therapy needs. But do you have any funny stories to kind of finish us off with, Jenny?
Well, this week has been super busy because we're trying to get ready for the county fair. And so I let my kids name their calves. And this year's been better because we have Tiny and Milkshake.
Right.
And Dairy Queen because they're Holstein calves. In the past, my son is not always the nicest. He named his calf Bob. And I go, you know Bob's a girl, right? He goes, fine, Bobby. And so he was comparing it to people he knew that was Bobby. And I'm like, don't do that. So he was comparing the cow to people. And I'm like, no, that's not a good start. So yeah, we're just getting ready for fair and working with our animals right now.
Well, hopefully you don't know anybody named Dairy Queen or Milkshake.
Yeah, so. I think those are pretty safe names.
Pretty safe. Good. Very good. Well, thanks for joining us again today, and we look forward to seeing you next time.